Ladies and gentlemen, good morning. My name is Charles Kolb, and I'm the president of the Committee for Economic Development. On behalf of our trustees and our staff, I want to welcome all of you and thank you for coming to CED's first forum on national health care reform, the role of the business community. Now, we have a busy and a full agenda today, so please begin your salad. I think the main course will be served in about 15 minutes, so you will get more than the salad. I'm very pleased that we have such a large number of CED trustees who are with us today, so I want to welcome them all. I want to start with former Congressman and New York University President, Majority Whip, John Bradamus. John, thank you. Stephen Crane is here, CED's former co-chair, Bo Cutter, Bob Colson, Erwin Doros, Kono Fusco, Hollis Hart, Bill Lewis, Lenny Mendonca, Alfred Mockett, Todd Petzel, Ned Regan, John Siciliano, Paula Stern, Pat Toole, and Jay Warrencline. And a very special welcome to CED's newest trustee, Lois Quam from Piper Jaffray in Minneapolis. Lois, we will hear from you later during the panel discussion, but I want to thank you for coming today, and a very warm welcome from all of us to CED. We're delighted to have you. I want to thank our host today, TIAA-CREF, and especially their CEO, Roger Ferguson. Roger, it's great to have you speak at another CED gathering. And on behalf of our trustees, and I think all of us here today, we want to salute you and thank you for your many years of public service as Vice Chairman of the Federal Reserve Board, and especially for the truly outstanding role that you played at the Fed on September 11th. So thank you very much. Today's gathering is underwritten by a grant to CED from the new Peter G. Peterson Foundation. We want to thank its president and CEO, David Walker, who is with us today and will speak at in just a few minutes. And I also want to thank Pete Peterson, who is also CED's longest serving trustee and the original champion of business statesmanship, the importance of having more American business leaders actively engaged as advocates of public policy reform. Now, last Friday afternoon, Senator Ron Wyden called us at CED to review today's program. And as Amy Morse and I were talking with the senator, it suddenly, I think I mentioned this to you, Ron, it suddenly occurred to me that we were launching our national healthcare reform discussion in the very same room here at TIAA-CREF, where CED launched its campaign finance reform efforts almost 10 years ago. Our keynote speaker at that event was Senator John McCain. So, Ron, Senator Bennett, first of all, I want to thank you for joining us and really salute and applaud the outstanding bipartisan leadership that you are bringing to healthcare reform. But I can't promise you that 8 years from now you'll be finalists for the presidency. But I do know that some very important things have happened in this room and that the business community outreach for CED around campaign finance reform started right here. And our goal, to be quite blunt about it, is to have the same catalytic galvanizing effect on healthcare reform that we achieved working with many others on campaign finance reform. So what is our goal in holding today's forum? We hope to begin a dialogue among the country's business leaders about the urgent need for healthcare reform, to help craft a strong business voice in advocating for such change, and to do so by first mobilizing business around a set of principles for reform. We hope that once you find out more about CED's reform ideas, that you will become endorsers, or that you'll decide that the bipartisan bill, the Healthy Americans Act, co-sponsored by Senators Wyden and Bennett, which has much in common with CED's approach, makes a lot of sense. But we also know that right now, there's a division in the American business community about the future viability of the employer-sponsored system. So wherever you come out, ultimately, of course, that's your decision. But what we hope to do now is to inform, energize, mobilize, and target business leaders to become advocates of reform. And for those of you who are here today, it's not a free lunch. You'll expect to hear more from us later with ideas and suggestions about things that you can do relative to the media, congressional testimony, efforts among your peers, and associations to which you belong. But we do hope that you leave here today convinced that the cost of doing nothing about healthcare reform in America is totally unacceptable. In the coming months, you will see a steady increase in the pace of our reform efforts. Next month, in Washington, D.C., the New America Foundation expects to announce a group of prominent stakeholder healthcare providers that will also be very public about promoting healthcare reform. And in January 2009, CED, along with the New America Foundation and McKinsey & Company, will host a Washington, D.C. leadership forum for business leaders, members of Congress, and congressional staff. At CED, we believe deeply that our country will not realize much needed healthcare reform if the business community is not part of the solution. When reform does come, business will certainly be affected, and in our view, we are more likely to have meaningful, structural, incentive-based, and market-oriented reform with business at the table rather than if business is absent.